Okay, class, so next week we will continue our topic about the respiratory system. Don't forget to do advanced reading at home. Class dismiss. Zell, regarding your class standing, I want you to really focus on this topic and report the function of the lungs.
What topic was given to you for your report?
I really like our topics about the respiratory system and cardiovascular system because those two share the responsibility of supplying oxygen and eliminating carbon dioxide. The difference between the two is that the respiratory system consists of the organs that exchange these gases between the atmosphere and the blood.
While the cardiovascular system has an exchange of gases within the body. If you need help, don't hesitate to call us, okay? Why? What's the problem? Are you okay?
Do you want us to accompany you to the clinic?
No, I'm okay. Good afternoon, Doc.
Good afternoon. What seems to be the problem?
We already brought the x-ray result, and these past few days, my sister is experiencing difficulty in breathing.
Inhale. Exhale. Perfect. Inhale. Exhale. Inhale. Exhale. Hmm. Okay. It seems like the result of your x-ray shows a buildup of tumor in this area. Your previous checkups were only due to asthma. That is why you're having difficulty in breathing, especially when you're exposed to causative agents such as pollen, dust mites, cold air, or even emotional stress. Are you experiencing any stressful situations right now?
Yes, Doc, I'm having some stress in my subjects and I might fail.
This is basically our respiratory system. As we breathe, the air passes through our nose, which is made up of a framework of cartilages and bones, the vestibules, which is lined with coarse hairs that filters out dust and particles. Then it will pass through the pharynx, which is also a passageway for food, and forms a resonating chamber for speech sounds.
If that is pharynx, the next one is the larynx, which is the voice box.
That's right. And the larynx also connects the pharynx and the trachea. Our trachea is designed to be long and lined with mucus, because it will thoroughly filter all the foreign objects that might enter our lungs. And this is now your left and right primary bronchus, with its bronchioles, where there is a small buildup of tumor. It is really hard to diagnose your real condition for now. That is why I would like to run other tests like CT scan and some medications, until there is a result.
Zell, are you okay?
Yes, I'm fine.
Zell, are you ready with your report?
Yes, Mom. The anatomy and functions of the lungs. Our lungs are paired cone-shaped organs located and filling the pleural divisions of the thoracic cavity. The pleural membrane encloses and protects each lung. It is composed of two layers, the parietal pleura, or the outer layer, and the visceral pleura, which is the inner layer of the lung. Between these two layers is a small space called the pleural cavity.
What seems to be the problem? Don't make an excuse for you not to finish your report. You should have prepared in advance.
The pleural cavity also assists in holding the pleural membrane together.
What now? Vianney and Christine, kindly assist her so she could just listen.
Ma'am, can we finish the report?
Do whatever you want.
The bronchopulmonary segment is divided into small compartments called lobules that contains a lymphatic blood vessel, an arteriole, a venule, and bronchioles from a terminal bronchiole. These terminal bronchioles are divided into microscopic branches called respiratory bronchioles. We also have the alveolar ducts, and around it are alveoli and alveolar sacs.
So, how do you explain the exchange of gases between the lungs and the blood?
The actual exchange of respiratory gases between the lungs and the blood occurs by diffusion across the alveoli and the walls of capillary network that surrounds the alveoli. And the membrane through which the respiratory gases move is referred to as alveolar capillary or respiratory membrane.
How did the student die?
Ma'am, I'm sure that she died not because of my fault or our fault. I see to it that the proper management was given to her. However, she just died upon arriving at the hospital, so it's not our fault anymore.
Okay, I'll try to have a conversation with the chairman and explain what you said about the incident.
I'll be leaving because I still have class. Respiration process. The purpose of respiration is to supply our cells with oxygen and to remove carbon dioxide gas produced by cellular activities. So there are three basic processes of respiration. The first process is ventilation or breathing. It is when the air that we inhale from the atmosphere enters our body. Ventilation has two phases, the inhalation or inspiration and exhalation or expiration. In inhalation and inspiration, the gases within the lungs spread out to fill the larger space, resulting in a decrease in gas pressure and causing a vacuum that sucks air into the lungs. As the diaphragm and external intercostal relax, The rib cage descends, the space decreases, and the gases inside the lungs come close together.